RFK Jr. is exactly who he's been for the last 20 years. When Senator Cassidy questions him about vaccines as a cause of autism, for which there's been dozens of studies showing that there is no association between getting a vaccine and developing autism, he says, if the data are there. RFK Jr. says, if the data are there. What is he talking about? Of course their data are there. He just ignores those data because it doesn't fit in with his fixed, immutable, science-resistant hypothesis that vaccines cause autism. His response should scare the American public, and it should scare Senator Cassidy. Well, his continual beating of the drum that vaccines cause autism continues to have an effect. So, for example, there was a paper recently published in the Journal of the American Medical Association that found that children with autism are less likely to get vaccinated than children who don't have autism. And in addition, younger siblings of those children who don't have autism, unlike their older sibling, also are less likely to get vaccinated. So what he's doing is he's lowering vaccination rates by sounding this false alarm that vaccines cause autism, and he simply refuses to agree. I think the thing that got me about Senator Cassidy, who I thought was very thoughtful in this hearing, was when he told a story about a patient he was taking care of who had a hepatitis B virus-induced cancer, and that RFK Jr. has decried hepatitis B. RFK Jr. said the hepatitis B vaccine doesn't work, even though when it was introduced in 1991 as a routine newborn vaccine, hepatitis B vaccine, we basically eliminated the 18,000 cases of hepatitis B that would occur every year in children less than 10. He's a science denialist. This is not a man you want in a position supervising science agencies like FDA, CDC, and NIH. Buckle up, because what's going to happen is I think vaccines are going to become more expensive and less available. And I think that our children will suffer. I think what we are about to enter is measles land. And you're already starting to see evidence of. We went from 50 cases in 2023 to roughly 200 in 2024. There was just an outbreak yesterday in Lubbock, Texas. And that is the most contagious of the vaccine preventable diseases. It's the canary in the coal mine when immunization rates fray, and that's what's about to happen. And I lived through the 1991 Philadelphia measles epidemic, when over a 3-month period, we had 1,400 cases of measles and 9 deaths in our city. One city. I mean, Philadelphia became a feared destination. Schools canceled trips to the city, and I just fear we're heading in that direction.